When I was growing up, I would play teacher. Now when I look at it, whether it's an auditing project, a consulting project, we are basically teaching our clients to improve the healthcare services within their own organizations. I have been in the healthcare industry for 30 years. I started in the coding world, and I remember when I was a coder that others were auditing me, and I would listen to these firms pretty much rattle off what my errors were. And as I went into consulting, I knew that when I had to educate or I had to give a seminar, that I had to not so much point out errors, but point out the patterns and the trends, and how do we correct that? How do we turn that into an opportunity and not a negative? HRAA is an innovative revenue integrity technology company servicing 900 plus hospitals across the United States for the past 10 years. The firm is built on a solid base of subject expertise, consulting and education, and coding. Using that base, we are quickly moving and adapting to their needs currently. The progression of the industry is moving very quickly, and we have positioned ourselves from the consulting standpoint into that premier leader in this initiative. To understand a coding system, it's taking a narrative written by a doctor, translating it into numbers, and translating it into reimbursement. Every diagnosis, medical procedure, or service has a dedicated code. Currently, we are understaffed with coders in the United States, and we need to grow that industry of coders to meet the productivity requirements. We are not going to outsource that. We believe we need to provide that employment within the United States, and we at HRAA are mentoring and growing coders to meet this need. HRAA is truly important to the healthcare industry and our own clients because of our subject expertise and how we keep up and have a pulse on what is going on in the industry and keeping our clients ahead of the curve, not behind the curve.